in term 6, we link our theory to practice, and our theory courses focus on chronic illness. And we see chronic illness from children's to adult population. So we're in the children's hospital as well as the other hospitals, and we help these patients get ready to go home and be discharged with their families and manage their chronic illnesses.
So they bring with them all that they learned in semester 5 about assessment and functional assessment, mental health, pharmacology, pathology, all of those pieces that they learned in semester 5, they bring into semester 6 and apply them to the very complex situation of living with chronic illness.
So the staff, I think, when we come into term 6, are really comfortable with where the students are in their learning. They understand that they have the basics from term 5, but they also know that there's a lot more work to be done and things that need to be looked at from the student's point of view.
So in term 6, it's very important to be self-directed with your learning. I find opportunities to learn. I ask nurses and I ask my instructor of what sort of things are happening on the unit that I can observe to increase my learning and see these things in the hospital setting that I will eventually be doing as a registered nurse.
Term 6 is their second clinical rotation in the acute care hospital setting. And so they're more comfortable in that environment, better able to function in the, beginning in the role of a registered nurse, in managing kind of the complexity that is the acute care environment, working with a multidisciplinary team.
With the knowledge gained from term 5 and term 6 around the pathophysiology of chronic illness, I find that in my clinical setting, I'm able to understand what could go wrong with my patient and anticipate it. And then when I see that something has gone wrong with my patient, I'm able to respond and react appropriately.
Compared to term 5, they seem to have a lot more confidence. Their organizational skills, you can actually tell that there's a thought process going with their critical thinking. It's starting to be developed. They're also responsible for medications. In this term, they're a lot more confident with those medications. They've already had some experience with subcutaneous injections as well as IV medications, and they're starting to get more comfortable as kind of the session goes on.
The advantage, I think, to the students is that when they learn to take that next step and try to figure out why they're doing what they're doing, they have the resources from the university, from the practice partners, and from the instructors to say, this is what we know and this is what we're going to learn.
Term 6 had lots of experiences and opportunities for me to grow as a nursing student. And from these opportunities, I'm just so excited to move on and continue to learn the skills of a registered nurse.